We're excited to talk about some great developments taking place that will shape the future of healthcare consumerism. My name is Susan Bambera, and I'm the Head of Marketing, Communications, and Strategy for PayFlex. With me here today are Jerry Russo, VP of Clinical Solutions at ActiveHealth Management, and Jonathan White, Vice President of Business Development for iTriage. So I'd just like to give a little background on both of these companies. ActiveHealth provides employers, plan sponsors, and healthcare systems with population health and wellness solutions to improve the quality and continuity of care, which combined lower healthcare costs. iTriage is known for their mobile consumer health platform to engage consumers with an easy-to-use symptom-to-provider pathway to connect consumers to providers who have the ability to deliver that care. ActiveHealth and iTriage are emerging businesses that are independent subsidiaries of Aetna. These two companies have joined forces to offer a robust mobile app aimed at enhancing consumer engagement and accountability for personal health choices. And with that, I'd like to have Jerry and Jonathan respond to a few questions. So Jerry, how do you envision the healthcare environment for consumerism changing in the next 3 years?
I see it as a progression of where it is today. I think we're going to see a growth in the account-based plans, increasing the number of members that are in these plans. These members are going to need to be empowered. They're going to need health information. They're going to need financial information in making their health choices. I think that there's going to be a tremendous growth due to that in things like social media, where a lot of members are looking right now with regards to getting health information, in both health-type applications and devices and those sorts of applications. And also on the provider side, I think we're going to see a growth due to the demands on the providers with regards to reporting on quality and cost, a movement toward utilizing tools that are going to help them to enhance the cost effectiveness and the quality of the care that they deliver.
Agreed. What do you think?
Yeah, I agree with everything Jerry said. I also am really gratified that we're finally getting to the place where consumerism is coming to healthcare. Consumerism has been out there for many industries for 10 years or more. It's changed the travel business. It's even changed the banking business. And it needs to change the healthcare business. And as consumers take a bigger role, a financial role in their own care, high deductible plans and things like that, I think it will be consumers that will actually drive providers and health plans and others to make the whole system more efficient and more about the patient. And at the end of the day, that's what this is about, is driving patient care, whether it's Jerry's business that is trying to promote care management, whether it's mine that is doing consumer engagement. All of that comes together if you can really engage that consumer with data and content and engage them at the time they're trying to make decisions.
Right. They want to be in the driver's seat.
They do, and they should be.
Right.
Yeah.
Right. So, Jonathan, what types of technology do you see critical to the success of driving this healthcare consumerism?
Yeah. You know, that's an interesting question because we are a mobile app, right? And if you remember or not, this did not exist 5 years ago. So if your question, the prior question was, where will things be in 3 years? It's really hard to know. It's hard to know what you don't know. But I think more than anything, it is the mobile platform of iPhone and Android that has changed the ability for the consumer to get in touch with healthcare. And it is that kind of platform that will allow Jerry's company to engage that patient at the time that they really need to. It is that platform that empowers the consumer to get information right when they need it. And anybody that's in that continuum or circle of member or patient engagement will benefit from the fact that they can reach out to them and serve up content and data, at the time that they're really trying to engage that patient. And everybody to date has struggled with that. But now we have a platform that's in people's hands all the time. Data now shows that many, 90%, I think, of iPhone or Android phone, smartphone users keep it with them 90% of the time.
Interesting.
Yeah. I agree with Jonathan. I think to take the platform a step further, to have that ability to enhance communication with the patients, for the patients to know that they are able to reach their healthcare team, and ask them questions. that they have the ability to look up information, on their illnesses. Or if they develop a given set of symptoms, just knowing which way to turn. Should I call my doctor? Is this something that I could just handle? I think, these things are all critical. I think combined with that, I think there's still going to be a very strong demand for a personal health record, particularly with the ability for the patients, number one, in order to find out if their employer, a lot of these account-based plans are basically adding incentives for the patients to get involved. And as they meet these goals relative to their incentives, they then would get credits either toward the amount of copay, or deductible that they might have, or toward their premium payments. So a PHR that would enable the patient to track exactly how they're moving along with regards to reaching those incentives, I think is very important. I think one that gives them feedback as to how they're doing with regards to their health. Are they high risk? Have they improved? Do they get that feedback? Boy, I've done what I'm supposed to do, and I've now moved from being high risk to moderate risk, or moderate risk to low risk. I think that's, that also is an important function. I think, certainly we spoke about the communication aspects, and then there's the teaching aspects. I think that to have a tool that will allow online teaching where, let's say that I have diabetes and I want to find out more about my disease and what I can do to get it under control and make it better, that I could go to my personal health record and be able to access some teaching tools that will take me step by step, what to do about diet, what to do about the other aspects of my diabetic care, those sorts of things.
Yeah, a lot of people want to do the learning on their own and get the information on their own. So
yeah, and they're demanding it, and they get it in all other industries. It's been a long time coming for them to get it in a language that they speak, not the lingua franca of medicine, which can be quite intimidating to non-medical people, but to be able to serve it up in layman's terms is really valuable.
Yep. And the other part is we can't forget the provider on this as well, because basically, once again, they're being graded in a sense, as to how they're performing relative to quality measures, relative to cost containment, relative to outcomes. And they're going to need those tools to help them as well. So, I think tools that will help them with regards to letting them know what's the latest in terms of evidence-based guidelines and plans of care for their patients, being able to target their patient populations to see, who might need more coordination of their care, and perhaps reach out from their office to the patient with a care manager, to help guide the patient, through the healthcare process. I think the ability to track their own performance measures and how they're doing relative to those performance measures, I think all of these are going to be very important toward improving the system.
And all the more important that providers will become, as healthcare gets more consumer-driven, providers are going to have to be more consumer-centric, patient-centric.
Exactly.
In the way they speak and the way they communicate, and becomes more of a customer service business as well.
Absolutely, absolutely. Okay, so Jerry, our final question here is, what initiatives are you taking today to position your company for the future of healthcare?
Well, I think, certainly one of the major ones is what we're doing with iTriage, in terms of linking up our two areas of expertise to deliver a mobile product to the patient that really addresses, all the needs that we were talking about before, being able to find out, about their disease, to be able to take steps with regards to scheduling, with regards to, being able to communicate, with their healthcare team. Certainly we're going to be expanding along those lines. We're going to continue to move forward with regards to our tools, so that tools for the providers, so that we certainly continue to build upon our already present infrastructure with regards to being able to give a given physician real-time surveillance of his patient population and let him or her know if there's a variance from evidence-based guidelines that we would then message the physician and the patient on. With regards to also continuing to develop tools that will enable physicians to identify, which patients would be most appropriate for outreach, with regards to care coordination activities, to continue to develop a secure messaging system. So also to give them the ability to track their performance, relative to quality measures and how they're doing, basically do the things that are necessary to reduce the incidence of medical errors and the fragmentation of care. I think another very important function that we've developed and continue to build upon is that ability to take in information from multiple sources, so that not just what's going on with that physician's office, but if the patient does see somebody outside of that office, or if they see a specialist, to be able to bring all of that information together into one location, and then to put it into a clinical context that's both understandable and usable for the physician, so that he or she has a nice, clear, longitudinal health record to give him or her a good feel for exactly what's going on with that patient's care.
Yeah, that's critical.
Yeah, and for us, it's about connectivity. If we are the middle of the circle with the patient holding our device, and around that patient are Jerry's company and the providers, doctors, all the other medical providers, and connecting. Our role is to connect those patients to doctors, connect those doctors to doctors. And so we look at connectivity, the health information exchanges that are being stood up around the country, no matter what happens to healthcare reform, will stand as a very valuable infrastructure. One of our sister companies, Medicity, is a leading HIE, and we will be coordinating and integrating more with them to be able to share files, whether it's lab results or images from an MRI or something like that. As Jerry said earlier, it's about whether it's personal health records or things like that, giving patients and consumers access to their information when they really need it on a device they have with them all the time, and be able to make that connectivity easier. You will take better care and take better actions, or actions that are better suited for your care, if you can understand price visibility, transparency, availability transparency, and things like that. And the mobile platform gives you all of that if you can just increase the connectivity points between to any of those providers.
Well, Jerry, thank you, and Jonathan, so much for joining us today and sharing all of this great insight into what's happening with iTriage and Active Health Management. We're excited for these developments, so looking forward to seeing them come to market.
Thank you.
Thank you.